Medicine is one of those fields where you're faced with death and suffering nearly every day, to different degrees depending on your specialty. When I was in training and working at a hospital, it was commonplace to see people die of horrible diseases where the best you could do to help was provide them with medication to minimize the pain and call the chaplain to help provide spiritual comfort. Even when people were not close to dying, you knew most people would have ongoing struggles with their diseases for years to come. And then there was that terrible car accident that left a young person paralyzed, the stillbirth that devastated a family, the elderly man with a hip fracture confused from his dementia as to why he was there. I wish I could say these things are rare statistical anomalies, but they are not. And healthcare workers are witnesses to these events day in, day out. So, why, when all this suffering is evident and ultimately preventable by avoiding procreation, do so many doctors still contribute to the overall problem by reproducing? Shouldn't we know better? Can't we put two and two together? Sadly, as a group, the answer is no, and there are many different reasons for this. First, there's a simple lack of awareness of choice in the matter. Doctors are subject to the same general social and cultural pressures that everyone else is when it comes to procreation, and most of the time, having children is not really seen as a choice, but rather as a stage of life one must go through. I don't think it even crosses most doctors' minds that by procreating, they are contributing to the very misery they are seeing every day at work. That their children would be exposed to the same myriad ways to suffer, and that this is completely preventable, in a way that is more effective at preventing suffering than any vaccine or surgery or medication. There's tremendous momentum behind most people, including doctors, to reproduce. Getting into medicine as a career is a long, involved process. For most doctors, the process starts as early as high school. With all the academic energy, extracurricular additions, and CV padding activities, with the goal of getting into medical school, once in med school, the life track is pretty much laid out. Go to residency, find a practice to work for, and have kids. This is almost automatic for a lot of doctors. And all along, things are so busy that there's barely any time, or so it seems, to think about the ethics of procreation. When your life is all laid out for you, and you are under the impression that there are certain expectations you just have to live with and carry out, it becomes easier to simply comply. No mental space to step back and say, is this right? Another reason I think there aren't more antinatalist doctors is that studying medicine doesn't magically endow you with moral insight. Medical training is largely designed to teach you to put out fires and clean up the messes presented to you. Prevention is talked about for sure, but what is taught only goes so far. It wouldn't be seen as politically correct to point out the simple fact that by producing children, people produce suffering where there previously was none. Contraception is talked about in the narrow context of avoiding unwanted pregnancy, not in the context of carrying out a moral duty not to impose suffering. There's another thing that happens during medical training that is seldom mentioned. When you are faced with so much suffering every day, you quickly learn to suppress your ability to process and absorb what that suffering means. In a way, it makes sense not to dwell on the tragedy in one patient's life when your job is to do your best in an efficient manner and move on to the next patient who will also need your full attention. But this comes at a cost, and it's one of the main reasons burnout is so common. So, as you get more used to the system, your empathy can be eroded away, and paradoxically, despite seeing so much suffering, it becomes harder to really understand it. And therefore, I think that for a lot of doctors, it would take a substantial leap to even consider antinatalism in their own lives. Of course, after saying all this, I realize that there are many doctors and other healthcare workers out there that do care to take a second to think about their actions when it comes to procreation and whether it is ethical, despite societal pressures. And I commend anyone who makes this effort. I hope more and more people in medicine care enough to pause and think. The same applies to everyone, but in medicine especially, we should know better. We don't really have any good excuses. Thanks for listening.